Hi students, welcome to Amigos IAS Academy. Today let us discuss about one of the most important flagship program of Government of India, that is ICDS, Integrated Child Development Services Scheme. This scheme was launched in 1975. In fact, this is considered as one of the oldest scheme which is being implemented by the Government of India for the benefit of the children and the pregnant and lactating women. And the nodal agency for the implementation of this scheme is Ministry of Women and Child Development. Now let us examine what are the objectives of this scheme. The main objective of this scheme is to prevent and reduce child undernutrition by 10 percentage points. This is the main objective of the scheme. So especially the children, those who are underweight and who are in the age group of 0 to 3 years are provided with supplementary nutrition to improve their nutritional standards. Okay, so therefore the main objective of this scheme is what? To prevent and reduce young child undernutrition. Then apart from that, to lay the foundation for proper psychological, physical and social development of the child. So this particular scheme will help for the holistic development of a child. And the children, those who are in the age group of 0 to 6 will be helped through this scheme. And this scheme will be helpful for the holistic development. That means the physical, psychological and social development of the child. Then to reduce the incidence of mortality, morbidity, malnutrition and school dropout. So, this scheme focuses on to reduce the incidence of mortality rate among the children and also morbidity rate, malnutrition and school dropout rate. So, keeping these aspects in view, this particular scheme has been implemented in India since 1975. Then apart from this scheme also focuses on to achieve effective coordination of policy and implementation among the various departments to promote child development, to enhance the capability of the mother to look after the normal health and nutritional needs of the child through proper nutrition and health education. And this particular point is very important. One of the objective of this scheme is to enhance the capability of the mother to look after the normal health and nutritional needs of the child through proper nutrition and health education. So that means through this scheme, health education is also provided to the pregnant and lactating mothers. Then as far as the target group is concerned, this scheme mainly focuses on children under the age of 6 years old and their mothers. Then as I told you, this scheme is meant for both the children and also mothers, more specifically the pregnant and lactating mothers. Then let us observe the key features of this particular scheme. Number one, it is a centrally sponsored scheme. Then the ICDS scheme is one of the world's largest and unique programs for early childhood care and development. This is another important point. This is a unique program for early childhood care and development. It is a centrally sponsored scheme engaging Anganwadi worker and helper from the same village. It is a universal and self-selecting scheme. That means anyone can visit to the Anganwadi center and enroll these services. That means this ICDS scheme is implemented through Anganwadi centers located in all the villages, and the services are provided by the Anganwadi workers and helpers in the same village. Then funding. And as far as funding for this program is concerned, all components of ICDS except supplementary nutrition program are financed through 60-40 ratio. That means this the budgetary allocations are in the ratio of 60:40. 60% of the budget is spent by central government, whereas 40% by the respective state government. Then the supplementary nutrition program component was funded through 50-50 ratio. The northeastern states have a 90:10 ratio. This is about the funding for the implementation of this program. Then this program constitute of certain sub-schemes. That means under ICDS, there are certain sub-schemes, or we can call it as an associated schemes for the benefit of the children and women. And those sub-schemes are, number one, ICDS Anganwadi services. It is for holistic development of children under the age of 6 years and pregnant and lactating women. Then as I told you, all the activities related to this ICDS scheme are carried out through Anganwadi centers with the help of Anganwadi workers. Then another one, child protection services. The first one is ICDS Anganwadi services. Second one, child protection services. It aims to provide safe and secure environment for children in conflict with law and children in need of care and protection and reduce vulnerabilities. This is very important. So, the children who are in a vulnerable situation, the children who live in unsafe and insecure social environment, such kind of children are provided protection under this scheme, which is also known as Child Protection Services Scheme, that is called CPSS, that is Child Protection Services Scheme. Then another one, National Crutch Services. It aims to provide a safe place for children of working mothers while they are at work, thus empowering them to take up employment. So that means under this scheme, the children are provided a safe place and security where the women work. That means the safe and security is provided for the children of the working mothers. So this kind of facility will help for the economic empowerment of women, more specifically the lactating mothers. Then another program associated with ICDS scheme is Pradhan Mantri Matru Vandana Yojana. In fact, we will discuss about this scheme in detail later. But now let us discuss about this particular scheme as a sub-scheme of ICDS. From 1st January 2017, the maternity benefit program is implemented in all the districts of the country. Under Pradhan Mantri Matru Vandana Yojana, a cash incentive of 5,000 is provided directly to the bank post office account of pregnant women and lactating mothers for first living child of the family, subject to fulfilling specific conditions relating to maternal and child health. In fact, this is a cash incentive scheme for the pregnant and lactating women, and there is a meaning for the implementation of this scheme. In fact, the financial assistance is provided to the pregnant women to cover the wage loss for working women. So, in order to cover the wage loss for a pregnant woman at the time of a delivery of child, the financial assistance is provided by the government. And this particular financial assistance is provided through the DBT, direct benefit transfer. So the amount is directly transferred to the bank or post office account of the pregnant women and lactating mothers. But under this scheme, the financial assistance is provided to the woman only for the first child, but the same kind of financial assistance is also provided for the woman if the second child happens to be a girl child. Okay, so that means if the second child is a girl child, then the lactating mother will be provided the 6,000 rupees financial assistance to the mother. So this is the essence of this particular scheme, that is called Pradhan Mantri Matru Vandana Yojana. Then another sub-scheme is scheme for adolescent girls. The key objective of the scheme is to facilitate, educate and empower adolescent girls so as to enable them to become self-reliant and aware citizens. The target group for the scheme covers out-of-school adolescent girls in the age group of 11 to 14 years. So here we need to observe two things. One is the scheme for adolescent girls is to facilitate, educate, empower adolescent girls so as to enable them to become self-reliant and aware citizens. This is one. And another important point is that the target group for the scheme covers out of school adolescent girls in the age group of 11 to 14 years. So these points are very important to understand. Then another one is nutrition component. That means under this scheme there are different components. Especially there are two components as far as this particular scheme is concerned. One is the nutrition component, another one non-nutrition component. Then as far as the nutrition component is concerned, take home ration or hot cooked meal, the financial norms will be rupees 9.5 per beneficiary per day for 300 days in a year. So under nutrition component, the adolescent girl is provided a take home ration or hot cooked meal, for which the financial assistance is provided at the rate of rupees, that is 9 rupees 50 paisa per beneficiary per day for 300 days in a year. This would be inclusive of the cost of micronutrient fortification. This is the nutrition component. Then there is a non-nutrition component. It includes IFA supplementation, health checkup and referral services, nutrition and health education, counseling, guidance on family welfare, ARSH, child care practices, life skill education and accessing public services. So all such kind of services are provided under the non-nutrition component. Then another aspect is the this is also associated with another scheme called Poshan Abhiyan, which we will discuss in detail later. But this Poshan Abhiyan is also associated with ICDS scheme. So under Poshan Abhiyan, it aims to reduce malnutrition in the country by 2022 in a phased manner. So that means the main focus of the Poshan Abhiyan is on reduction of malnutrition, especially among the children and women, more specifically pregnant and lactating mothers. So these are the important aspects related to ICDS.